Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And we're excited to be talking with Jeff Becker. He's VP of Portfolio Marketing at FinThrive, and John Yount. He's Chief Innovation Officer at FinThrive. Welcome, guys.
Thank you.
Thank you.
Yeah, so excited for today's discussion. But John, how about you start us off? Tell us a little bit about yourself and FinThrive.
Sure. My name is John Yount. I've been with FinThrive for about 7 years. I joined as part of the TransUnion Healthcare acquisition. And generally, I have responsibility for anything that has to do with data and analytics, technology where we wrap a service, or as we expand into some of the adjacent markets.
Nice. Well, if it has to do with data and analytics, that's everything, I guess, now.
That's exactly right.
That's how it's expanding, right?
And in regards to FinThrive, more specifically, we've been on this journey to really change revenue management. We've been pretty focused on trying to figure out ways to advance the healthcare economy and do that in a way that we can make things more frictionless for patients, payers, and providers, all at the same time while trying to really deploy an end-to-end comprehensive revenue management platform.
Awesome. Jeff, how about yourself?
Yeah, so I'm Jeff Becker, VP of Portfolio Marketing. What that really means for today's discussion is I lead our market research team. And so one of the ways that we're thinking about helping to advance the financial experience of patients and revenue cycle management more broadly is just by contributing thought leadership, contributing research, and helping give providers some of the knowledge that they need to be more strategic about their plans and their investments. And so that's what we'll talk about today.
Awesome. Well, I mean, Jeff, you and I go way back. We've talked about health IT adoption models over a lot of different years and different experiences. Talk to us about the premise of an adoption model in general.
Sure. Okay. So when you think about an adoption model, not every industry actually lends itself to an adoption model. There's a few core ingredients that you need for something like this to make sense for an industry. First, there needs to be enough technology sprawl within that segment for an adoption model to be needed or to make sense. If you've only really got one or two technology profiles that your organization is using to serve your function, you don't need an adoption model necessarily, but in revenue cycle, there's hundreds of technology categories vying for RCM leaders' attention and ultimately investment dollars. And so there's value in helping to create a conversation around what's working and what's not. There's a couple of other components, though, that really set an industry apart as being prime for introducing an adoption model. And one is that you need an adequate distribution of early innovators, early adopters, people who are leveraging new technology as it comes out. You really do need a healthy population of those innovators, because that's really where you glean insight into, as new technology is making its way to the market, what is working. And then last, you need a large cohort that would be on the earlier stages of any kind of technology adoption model, because that's who's going to benefit from doing the research. So there's a few elements that are sort of required before we would even entertain going down a path like this. So we did some initial looking at, certainly we see that the vendor sprawl and the technology sprawl is in place, but are there enough early adopters to really start generating meaningful insights for the market? And is there a large enough cohort of new entrants or less mature users of technology that would benefit from us doing this research? And we found all that in RCM.
Interesting. Yeah, I mean, if everyone's adopted it all, then an adoption model doesn't really help them.
No, it doesn't become helpful until you really have all of those pieces.
And how have you seen this play out in the healthcare space, right? I've never seen it in the RCM space till this conversation, right?
Right.
Or the revenue cycle space. You know, where else are you seeing this in the healthcare, and how widely is it adopted? Where have we seen other successes that we could learn from?
So I think the one that everybody that's been working in the healthcare industry would look back to is the HIMSS EHR adoption model.
Yeah.
The HIMSS EHR adoption model drove significant and focused technology deployments across the clinical side of our businesses. And so you can see that in a few different areas and use cases. A classic one is before health systems were pursuing HIMSS Stage 6 and HIMSS Stage 7, what you'd really see is still broad-based verbal order readbacks or written orders from the providers. Those would get keyed into the electronic health record by the nurses. and manually administered on a paper medication administration record. Today, if you walk into a health system, they're using CPOE, computerized provider order entry, to enter their medication orders. Those are then being administered with barcode scanning at the bedside to make sure that we're checking off all of our 5 rights of patient safety. And so you've seen sort of this evolution of technology utilization just in this one space, and that was largely driven by that focused approach to introducing a maturity model for electronic health record function adoption.
Yeah.
If you think about it in terms of the adoption of EHRs, I was fortunate earlier in my career, I participated quite heavily in the rollout of the EHRs, specifically around medication administration and adoption of CPOE and sort of the 5 rights to ensure the safety component. But the core of adoption models is really to optimize. And so if you think about the EHRs, it was to optimize patient care, which has had its benefits. It's not perfect. I mean, there's still work to be done. There's still improvement that can be done around interoperability, sharing of data, but it has had a net benefit to the optimization of patient care. In the case of a revenue cycle management adoption model, technology adoption model, the intent is the same. We want to optimize the financial performance and the revenue management of health systems.
Yeah. So talk to us about it. FinThrive decided to embark on creating one specifically for revenue cycle management. Why did you do that?
Well, we saw the opportunity, but more so in our own market research and in market research from other organizations that are publishing into the market, what you'll see is really 2 coinciding events. One is that we're at a culminating point in healthcare finance. These health systems have been running on negative margins for over a year now. There is a sense of we need to take action. Something needs to be done. We need to think bigger, be bolder, and when you double click into that and start looking at how health systems are looking at increasing revenue, you're actually starting to see a decrease in some of the traditional revenue growth strategies like opening new facilities, expanding service line options. And what you're seeing take place of that is digital transformation of their RCM. So what they're really looking to do is capture all revenue owed rather than make large investments in expanding their geographic footprint. And so we want to make sure, as John said at the outset, we're trying to advance the healthcare economy. We're meaningful when we say that. And so we thought in this opportunity, what we could contribute to that is insight into, if you're going to be making investments in revenue cycle, digital transformation initiatives, and modernization initiatives, we can lend some horsepower and some analytics to what's working and what's not, and sort of help pave the way for organizations to provide that benchmarking.
That's a good point on the analytics. I hadn't thought about that. You have access to a lot of data that will help them in understanding the maturity as well. I like that. John, is there anything you'd add, kind of from a perspective of a revenue cycle leader, why is it important for them? How could they leverage an adoption model? Talk about that.
Yeah, sure. So first of all, as we think about an adoption model for technology, I mean, the whole intent is to figure out how to move the industry forward. And we believe that the deployment of this type of model can make a material impact in the approach. As you think about why it's important to a revenue cycle leader, a health system, if you think in terms of investment, they're always trying to evaluate what they can do to reduce the amount of time it takes to collect, to improve their clean claim rates, to reduce denials. And really what this does is it gives them an opportunity to evaluate their full revenue cycle, assess where they have capabilities, help them understand and prioritize, invest in the right solutions, and then ultimately optimize it. And so when you think about in terms of driving financial performance improvement across any of the typical KPIs that you would see in an organization, it can have a material impact there.
Interesting. And Jeff, talk to us about the process you went into developing this. I imagine many in the industry would be like, well, do I trust a vendor? Like,
Sure.
give us a feel for like what went into adopting this, adoption model for revenue cycle.
Well, we're not blind to that concern. And so at the outset, we designed this to be vendor agnostic. There's really two criteria for what we were trying to build. One, we wanted it to be data driven, and two, we wanted it to be peer reviewed. And so we set out to measure technology adoption, perspectives on the value organizations were receiving from that. So we wrote a survey in collaboration with industry analyst firms and our own internal stakeholders. We surveyed on over 100 RCM technology categories. And why we did that was because we really wanted to capture the breadth of RCM and then really spill over into adjacent areas so that we could capture the full scope of what health system leaders think of when they think of RCM technology. So we surveyed 100 RCM financial leaders from director and above, and we asked them a few things. So first we asked them, what is their point of view on these technologies? Is this mission critical? Is it high value? Is it moderate value? Is it low value? Or is it not RCM at all? And so we took that and we scaffolded our adoption model only on the mission critical and high value technologies, and we removed everything else from the model. So we really wanted to be focused on what is delivering value based on the perceptions of those financial leaders. And from there, the next thing that we wanted to understand is what's being adopted today. So we said, are you using this today? And so we captured whether the organizations were using it now, whether they weren't, maybe they're partially deployed or they're piloting it just in specific service lines, or maybe they're planning on deploying it in the next 12 to 18 months. So we captured those kind of understandings so that we could start scaffolding out high value mission critical capabilities that were broadly deployed. 80-90% of the market's already using this. We can call that stage one of an adoption model, and it's a really logical place to start. From there, we can move on to low adoption technologies that are still perceived as being high value and mission critical. And we like that because when you step back and you look at the results of the model, what you'll see is that late stage, it does a really nice job of picking up emerging technologies that are having a significant impact on the market. And so it gives the industry a tool to see what they're likely not using today, but that their peers are saying has delivered high value. And so we went through that process of working through the adoption model itself. The next thing that we needed to do is say, all right, so how would an individual organization benchmark themselves against this data set? At that point, we had over 30,000 data points in this model across all the questions that we asked. And so, but we want it to be personalized to Lynn General Hospital. And so how do we get a intake assessment designed that would allow us to benchmark you within this data set, help you understand where you are today and where your peer group is investing to move themselves forward through technology adoption. And so we built out an intake assessment. We had a meeting with our FinThrive advisory board earlier this year. We presented the intake assessment and the full model to them, got a lot of great feedback, implemented all of that feedback. So that was sort of our first beta testing. And then since then we're beginning to take health systems through the model, beta testing it, continuing to iterate on the process, and we're excited about the results. People are very excited about it. They're feeling like, we wish we had this at budget time. We wish we had this earlier in the year. So the value the excitement around it and the value that it's starting to deliver is meaningful.
Something to add to Jeff's comments. I think one of the important components that Jeff and team focused on as they were building out the research and starting to build the adoption model was that we needed to be agnostic. And so your earlier point about how will it be received that is coming from FinThrive, we recognize that that's a challenge, but we also recognize the intent, and the intent is to move the industry forward. So we are building it in the sense that you can look at your entire revenue cycle, you can look at the solutions you have deployed, and you can make decisions about what would be the most impactful to your organization. And some of those may be FinThrive solutions, but candidly, many of them won't be, and probably the majority of them won't be as well.
Yeah.
One of the other pieces that I think is important about it is we didn't just capture technology adoption, we captured financial performance, because this is a tool that's been designed for revenue cycle professionals. And at the end of the day, it needs to impact financial performance. And so with every question, with every survey we asked, we also asked, what are your clean claims rates like? What's your denials rates like? What are your AR days like? And we started to create a data set that correlated financial performance with technology adoption. And so we're introducing this multi-stage RCM technology adoption model that shows the story from low technology utilization to high technology utilization and its overall impact on financial performance. And so that's a piece that has people excited as well.
Yeah. So John, talk to us about how you see this evolving over time. Most maturity models do evolve. It's not just, because technology keeps evolving. How do you see this evolving?
Yeah, so it's been interesting as we rolled it out initially to our advisory board and have had a number of conversations since that. What we've found is that we've gotten great feedback. There's been areas already that have been identified on how we can expand upon what has been done. So initially it's the idea of what technology needs to be deployed, what total impact or improvement can be made in specific KPIs. But an area that's been highlighted for us is the fact that it might be interesting to improve one KPI, but you also have to know what level of investment is needed to drive that. So I believe it's going to evolve into also being an ROI model as well. So it's going to give you the opportunity to really assess what you have to do, assess what the investment is, and assess what the return on investment will be.
Yeah. So you both talked about your advisory board and their reaction. How are the customers kind of receiving this to date? What value do you see them receiving? Maybe you could start and follow up.
Yeah, enthusiastically. Across the board, the feedback has been very positive. There's been recognition that the industry needs a model such as the one that we're proposing and bringing forward. It was interesting. We were at a conversation the other day, and we introduced it to a customer. We walked them through their results. And at the end of it, we asked them their opinion, and they very clearly stated, I wish I would have had this when we were going through our strategic planning, because it puts them in a position to really understand where they have opportunities. And then if you're thinking about whether it's a budget for the next year or whether it's a 3-year plan that you're building, it helps you understand where that investment should be prioritized.
I think there's also value in, from the colleague experience standpoint, there's pride in being a modern tech shop, and there's value in that in recruiting. We want to know that the organization we're going to is forward thinking and innovative, and when you work at a shop and you put these hours in implementing technology and optimizing processes, you want to know that you're a stage 6 or stage 7, or there's value in that to the people that work in the business, and there's a sense of pride that comes along with moving your organization down a pathway that way.
I think even to expand on that, so I've deployed adoption models in other settings as well as a responsibility for running product. I've had maturity models that we've deployed to help our organization understand how you move from maturity 1 to maturity 5. And depending on the type of solution that you're building or developing, you have different levels of quality that have to be deployed. But in that process, you help the teams and colleagues really understand what has to be accomplished, what processes have to be deployed, what solutions have to be in place, and the benefit that it drives. And so as they make progress, they start to see that as well themselves. They hopefully start to feel that the organization is progressing in a manner that's making their job easier. I mean, automation is always a benefit if deployed appropriately. And when you just look back as an organization and you've participated in a process to move an organization forward, it makes you feel good.
Yeah, and I've seen that in so many of the health IT adoption models, especially the EHR one, obviously being in the forefront, is that it inspires the team to have a goal,
yes,
right? And so it almost creates a vision and a goal that everyone can get behind, and so it coalesces people in an interesting way. It sounds like that's what you're creating with this model as well.
Yep. Most definitely.
Interesting. Well, I know it's early. Any other final thoughts about this? Other experiences that you've had, or things that people should expect from FinThrive, and where can they go to learn more?
You want to touch on what some of the community discussion that we've had?
Yeah. So some of the things that we're starting to talk about are how do we roll this out in a way that it could be accessed in a digital community environment where people can start sharing best practices within the stages. And so we're having conversations about potentially partners or ways that we could bring that out. We're up on our FinThrive.com website, so people will find more information about it there. Some of the stories that we're seeing, so we're in our peer review stage right now, so we're moving through our FinThrive Advisory Board customers, and I guess my favorite story at this point was when we were at our FinThrive Advisory Board and we were initially presenting this, we didn't really know if it would be of value, how much value it would be.
Sure.
So we presented the basic premise, and I said, okay, raise your hand if you would use this strategically within your organizations. And there were about 20 of our strategic customers there. And everyone raised their hand. And I said, okay, raise your hand or keep your hand up if you would be willing to work with me and peer reviewing this and benchmarking this with us, which takes actual work. And everybody kept their hands up. And so I knew, okay, we're onto something here. This is something that the industry needs, and they're willing to roll their sleeves up and help build it.
Yeah. Awesome.
And I think in terms, when you think about thought leadership, when you think about moving an industry forward, it's fun to be a part of something like that. I mean, it is. And you look back and you see the progression, and you know that you've made an impact. And so earlier, even Jeff was talking about colleague experience. I think many times it can be difficult for an individual team member to really understand how they're contributing, and what they do every day makes a difference. When you look at it in the form of a technology adoption model and you understand the stages, and when you really dig into some of the details, you can get a direct understanding and correlation to where what you do every day is impactful and valuable. And I think that goes a long way in building a team culture, and then ultimately to what the organization's trying to do, which is deliver good patient care and financially perform well.
Sure. Well, I appreciate you all taking the time to share this. I'm with you. Adoption models, there's an exciting time right now of innovation that's happening that maybe wasn't happening a few years back. So it is interesting at this time that it is the right environment for an adoption model to consider all of the innovations that are happening. So appreciate all the great work you're doing there and sharing these insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com and search for Healthcare IT Today on your favorite podcasting application. Thanks, guys.
Thanks, John.